Hi, my name is Brooklyn Foster, and this is a presentation on polycystic ovary syndrome for my Bio 139 class. Polycystic ovary syndrome is also commonly referred to as PCOS. The signs and symptoms can include hyperandrogenism, which is a excess of androgens produced in the body. It can also include oligomenorrhea, which is irregular menstrual periods, chronic anovulation, which is the absence of ovulation over an extended period of time, polycystic ovaries, which is basically the ovaries have developed too many follicles in them, which has resulted in multiple almost fully developed follicles residing in the ovaries for a long period of time, which can also result in and be caused by an endocrine imbalance, a hormone imbalance. Obesity is also frequently found in PCOS, although it's unclear whether obesity causes PCOS or if PCOS causes obesity, but there is a high instance of insulin resistance in PCOS, which can also result in hyperinsulinemia, which is an overabundance of insulin in the blood. Another common symptom of PCOS is hirsutism. I apologize if I'm mispronouncing that, which is an excess of body hair on the body. Also frequently seen are acne and alopecia, which is a falling out of the hair, which is very similar to the excess hair. It's similar, but on the other end of the spectrum. The causes of PCOS are currently unknown, but there are likely genetic and epigenetic influences. We've also seen this because there are women who are predisposed to PCOS who only develop it when they gain a lot of weight, or in some cases when individuals undergo a female-to-male hormone therapy involving testosterone that can sometimes trigger the onset of PCOS. It is definitely has some genetic influences though, because there is a high instance of families, multiple people in families having PCOS. It runs in families. The research is pretty limited though, because PCOS only shows up in people who are biologically female, so it's really hard to research because only half of the population has the chance to develop PCOS. Obesity is suggested as a cause, but again, it's very hard to tell because obesity is also a symptom of PCOS, so it's hard to tell if one is causing the other. It's hard to tell which way it's going. It's a correlation versus causation issue, but obesity is definitely a risk factor, as those who are obese have a higher chance to develop PCOS in the future. The diagnostic testing involved in PCOS is kind of hard to figure out. It is primarily a diagnosis of exclusion, which means there are a lot of similar diagnoses that have very similar or the same symptoms that have to be ruled out before a diagnosis of PCOS can be given. So there's a lot of testing involved in that because there are so many diseases that can replicate the symptoms of PCOS. So the only diagnostic tool that is specifically related to PCOS and only really used when they're already suggesting PCOS is a ultrasound of the ovaries. As I mentioned earlier, the ovaries, polycystic ovaries, are a main symptom of PCOS. So an ultrasound would be able to show if there are more follicles developed than there should be, which is usually, I believe, 9 or more follicles that are about approximately 9 millimeters or more across. This excess of follicles will be caused by a hormone imbalance, which again is tied into the whole diagnosis of PCOS. Again, there's a lot of other testing that can be done to check for the level of androgens. The presence of other symptoms is also a very big determining factor. Because it is a diagnosis of exclusion, the only way you can get a full diagnosis is, again, by excluding the other diagnoses, and you can only get a full diagnosis if you have at least two of the main symptoms of PCOS. So the treatment for PCOS is pretty varied because there are so many symptoms of PCOS and they're very different symptoms. So there are several medical doctors and professionals that can be used or that can offer assistance in the treatment of PCOS. There is no cure for PCOS. So treatment for PCOS is primarily just management of the symptoms. So an endocrinologist would be used to help balance out the hormone levels in the body and reduce symptoms that way. There can be several issues with fertility in cases with patients with PCOS. So in that case, an OBGYN or a reproductive endocrinologist would be really helpful. And of course, a dermatologist can help with the excess hair growth, the acne, and the alopecia. All of those can be done. There's several different ways that you can treat these different symptoms, but again, it's only treating the symptoms. There is no cure for PCOS. Diet at home. Diet does not directly affect PCOS. The things that you eat do not worsen or improve the symptoms of PCOS on their own. There is no direct correlation there. However, as I mentioned earlier, obesity is a large risk factor. So weight loss diets and stuff like that, methods to reduce weight are very highly recommended if you want to reduce your risks of PCOS, and weight loss can actually improve the symptoms of PCOS once you have it. So there was a study that showed that even a 5% decrease in weight can almost entirely normalize the menstrual cycle of a woman with PCOS. So the prognosis, again, there's no cure, but genetics play a large role as far as we can tell. It may even be congenital. There was a study based on excess androgen exposure in utero that produced symptoms similar to PCOS in animals. So we can tell that there's probably an epigenetic influence there, that some people may be at risk, and then epigenetic or environmental influences can cause the expression of PCOS in that person. There are some early signs of PCOS, which include early adrenarche, which is the early activation of the adrenal glands in producing androgens. Early puberty is also a similar early warning sign, and unusual periods or I apologize if I'm mispronouncing this, oligomenorrhea, which is, again, irregular or unusual periods, especially in adolescence, can be an early warning sign. The long-term implications of PCOS can include, again, fertility issues, an increased risk of miscarriage, anovulatory infertility, which is infertility based on the lack of ovulation. Again, the hormone imbalances can cause you to not ovulate, which is why there are so many underdeveloped follicles. More long-term implications can include pregnancy-related complications, again, risk of miscarriage, gestational diabetes, type 2 diabetes mellitus, and cardiovascular disease are all long-term implications that can be that come alongside PCOS. That was my presentation. That is PCOS in a nutshell. Thank you for watching.